Hi, this is Unlimited Access by Ursamin. My name is Levi,
Shannon Aylesworth.
and today we're going to be talking about the Collision Conference.
Yeah.
All right. So we attended the conference. I say we being you.
Me.
But Ursamin represented. Our bear was there.
Apparently nobody on my team has their passports up to date. And I didn't ask the one person who could go. So yes, it was me and the bear.
Yeah, my passport is up to date because I'm ready for that call. The person that says, "Let's go play St. Andrews." I want to be able to get on a plane and go. No questions asked.
Yeah.
Okay. So, what was the Collision Conference?
The Collision Conference was a startup conference. It was really interesting. It was kind of pushed as a investor startup conference. They do them all over the world. But it really became about seeing the latest and greatest startups and the technologies and the applications, and it was cross industries. It was different stages. It was alpha, beta, pre-seed, seed, if you know all those terms. It was basically AI crazy. And then they had like 7 stages where they had presentations. It might have been more. Where they had presentations, there was like 20 tracks of information of what's going on in that industry. So there's a health industry, a VC industry, a enterprise industry, SaaS industry. So it was literally 3 days of presentations, panels, and in between that, there was the exhibition floor of all these startups. So it was crazy. People kept saying to have fun. I'm not a big conference person. It's not normally I did a lot of them for years, so I don't really like that. But this was really exciting to see how many brilliant people there are out there.
Right. What's collision even mean? I mean, it was a very odd name, I guess.
I gotta be honest, I don't know. I wish I had prepared for that question.
I had visions of it being like
I'm guessing
collision of like VCs and entrepreneurs colliding together.
I bet you that's what it is. I mean, that's probably what it should be, because it's all about bringing VCs and startups together.
Okay. So you're there.
I learned while I was there. I didn't know that much about it myself.
What was the most I was trying to think I was going to say what was the most, not entertaining, what was the most learning thing, but that's not the right way to say it. What did you learn while you were there?
Interesting thing.
Now, what did you learn? That's what I wanted to say, but
I learned that, what did I learn? I learned so much. Just all of the startups that are in the healthcare industry are inspiring. There's a lot of startups that need to partner with somebody like us, so we had a great opportunity to talk about partnerships. And one of the things that you do as a startup is look to see who can help you get bigger, especially in healthcare, because healthcare is so saturated. The idea is that you partner and stop making just more noise. So learning of all of the different devices. I saw an artificial kidney. That was kind of crazy. It's an artificial external kidney. I learned a lot about that. I learned the pitches were really cool. There's pitch showcases.
Well, when you say, let's talk about partnership, because I think that's the most interesting thing to me, is this idea of like where Ursamin sits in the medical industry versus everything else, right?
Yeah.
So a good example is like that kidney that you talked about, this artificial kidney. That's such a unique, very specialized, small part, important, but small part of the medical industry, because not everybody's going to need an artificial kidney, right? But our service can be a part of the whole thing. Like that kidney, if you had that kidney, right, you could put that in Ursamin, right?
Yeah.
And then if you're like what Dr. Julie was talking about a couple of weeks ago on our phone call, she was talking about how she was helping a patient, and the patient didn't know if their back thing was MRI safe, right? But because but we could put that information in there. So I think going back to these partnerships, i.e., maybe you can't discuss who you want to partner with at this point in time, but what are some of the partnerships that you thought were interesting that, hey, Ursamin could really?
Yeah, there's probably 4 that were really exciting. One, HIPPO AI, it's a family medicine doctor co-founded. How to get faster, better clinical decision-making power out of the information you do have. So one of the big challenges within the technology that they have today is finding information. It's not just that they don't have it in one place, but that it's hard to find what you need. because it's kind of buried in there. So doctors spend a lot of time, and so there's multiple doctors trying to solve this problem, where how fast can you pull that data to the top from a diagnosis decision making. So, hey, I need their A1C for the last 12 years. Boom, AI can go look for that. So HIPPO AI was really cool. We were actually looking at our AI enhancements on, as we continue to build our engine. Hey, we don't just layer somebody on top would be really cool, because then we can make the provider side, the information more effective, and help them, kind of see the future of that. That was one. Elder Prime was a really cool company. They address specifically the elder community and caregivers, and it was on the what side was it? Crap, I'm drawing a blank right now. Apologize. I can't remember. I'm going to have to skip that one. But Elder Prime, I had that. There was an integrator next to me that is similar to the integrators we have in the U.S. of information, wearables, clinical wearables.
This was in Canada.
In Canada. These were, most of the companies I met were Canadian companies. They kind of go around the world, so I don't know if there's one in the U.S., but there was a lot of Canadian companies. And there was a chatbot support AI piece where we could literally outsource support. As a startup person, you're always trying to bootstrap, and you're always trying to do everything cheap. If you can find a way to make this stuff cheap, and people have built that software where your chatbot can be automated, so you don't have to have support people. One really cool one, this kid had to take care of his mom. She had cancer. They were trying to find clinical trials, and he showed me the clinical trial database. He's like, you wouldn't be able to read it. So he's writing code to go into the clinical trial database and match your disease with clinical trials that marry up with your disease. Mm-hmm. If you were to read this is literally, it's like the most perfect example of what I was like, we don't understand. How do you get into a clinical trial if you don't know what that language is? You don't know if you apply. The only way to know if you apply is if the doctor can say, oh, this is a good clinical trial. Doctors don't have time to know every clinical trial for your disease. So this kid's writing a code that will sort through hundreds of thousands of clinical trials and say, here's the top 10 for you. And he's like, I'll say he's like 24. He's taking care of his mom. And so it was really, really cool. So definitely I was like, listen, get it written and let's partner up, because that's a huge resource for patients.
Those are a lot of really good partnerships. And again, I think the thing that's really powerful for us as Ursamin is we're centered around the patient. Like, without the patient, there is no healthcare. Right?
Yeah. It's about customization. The patient is,
Right.
The patient's so unique, and that's the hard part, is everybody is unique. Somebody said to me, you can have identical twins who have the same disease and it will never present the same.
Right.
Even if you're the same person, basically. So many different ways to offer and customize it to help patients on their journey. It's really cool. And there's so many providers, like the family medicine doctor who did HIPPO AI came up and said, oh my God, I love what you're doing. I can't tell you how many patients come in and say, my neurologist said this, but I don't know what the neurologist said, so how am I going to comment on that if I don't know that? I tell her to call the neurologist, but if we were all in the same system, then we'd be able to just reach out to the neurologist and say, okay, now I can help this patient. So think about the patient journey as skipping through people. That was really inspiring.
So we sound like we have some future podcast guests.
Yeah. Oh, yeah. Yeah.
All right, good.
Yep.
Well, the Collision Conference is exciting for all of us on the Ursamin team,
Yeah.
right? Because
was
we
our
have
first.
we have this product, this service that is exceptional. And as we're getting more and more people to sign up and use it, we're getting to that point where we want to expand services and offerings and the way it goes. And that's where, you out there as a fellow Ursamin person, I appreciate you on the grind for the team.
Thank you. It was our first conference, so we hadn't really done something that big, so that was really exciting, and it was a easy drive for me. So.
Well, I also liked the fact that you're really proud to see the bear.
Oh, I loved seeing the bear. I know, everybody's probably like, the logo was fine. It was fine. We just wanted something that really represented our mission and our vision, and it was cool to see it up there.
Yeah, it really is.
In the big lights. No, it wasn't.
Big lights.
It was in the tiny alpha group, we were alpha. Our little 4x4 booth.
Is there anything else about the Collision Conference that the listeners should know?
No, it was a really great it was a really cool way to get with a bunch of people who are entrepreneurs and looking at the future and thinking out of the box. Like I've done that for my kind of whole career, has been about finding new problems and bringing new products to market. But have that many people in one place, the ideas that flow and the willingness to help each other was just inspiring. So if you're in that stage, it's a great event.
Fantastic. Well, thank you again, listeners. Yeah, thank you so much for listening in, and thank you again, Shannon.
Thank you, Levi.
Bye.
Bye.